Okay, let's try that again. All right, so welcome to the Lens Leadership Excellence Network's informational session. I'm Melanie Standish. I am the program manager for NCHL's Leadership Excellence Network. Lens is one of our premier programs as a part of the National Center for Healthcare Leadership, and we're excited to tell you today all about it. And we thank you to everyone for joining. See, there we go. Agenda for today's session. So we'll talk about what is Lens. I'm sure that's why you're all here. If you have, maybe you've heard about it before, you know a little bit, but a lot has actually happened in the past year in terms of the growth of Lens, the programs that we offer, and the different topics that we're focusing on. So even if you've heard about Lens before, it's likely that a lot has changed all in good ways. So we'll be talking about that today. And then we'll do an overview of councils and hear from current members. We're really excited to be welcomed by each of the chairs of our councils today. And so you'll get to hear from them firsthand about what the councils are all about, their experience at their organizations, and how Lens has been a benefit to them. And we're just excited to hear from them. And then learn how to join. So at the end of this session, for anyone that attended or wasn't able to attend, I do have an informational packet on information on how to join. So I will be sending that after the call, but we'll have time for questions at the end as well. So I will like to just mention who's on the call today. So like I said, I'm Melanie Standish. I know Leanne Swanson, the CEO of the National Center for Healthcare Leadership, is also on the call as well today. So hello, Leanne. We also have each of our council chairs on the call. I'll have them introduce themselves again when we get to each of their council slides, but we have Tara Wiedemann, Senior Director of Human Resources at Carilion Clinic, is our steering committee chair. Jan Harrington Davis, Vice President of Talent Acquisition, EEO and Workforce Solutions at Henry Ford Health System, is our Diversity, Equity, and Inclusion Chair. Patty Edelman is the Vice President of Learning and Development and the Physician Leadership Institute at Northwell Health and is our Leadership Development Council Chair. Doug Crowder is the Director of Workforce Intelligence at Carilion Clinic and is the Talent Metrics, Analytics, and Planning Council Chair. And then we also have Catherine Meese, who's the Director of Research at the Office of Wellness at UAB Medicine, among with other titles, professor, lots of other things at UAB. So, and she's our Wellbeing Council Chair, which is our newest council. So very exciting to have them all today. So first, what is Lens? Well, Lens is an institutional membership group in one of the three premier programs of the National Center for Healthcare Leadership. We really seek as a cohort of hospitals and health systems across the United States to advance talent management and leadership development practices. And this is really done through a council style fashion. So I'll talk a little bit about the structure of Lens, but essentially when an organization joins, they're able to participate on a variety of different councils related to what I would maybe consider hot topics in the field in terms of human capital investment, talent management, et cetera. So it's a really great group to be a part of. Really, it's a way for hospitals and health systems across the US to collaborate on various projects, share best practices, advance the evidence base around talent management and leadership development, and just to really actively share their experiences. I think one of the things that they'll probably highlight and we hear about the most is that the peer-to-peer networking opportunities is really just probably the greatest benefit of Lens membership and being able to call one of your friends at 3 o'clock in the middle of the night, as one of our Lens members used to say, is just that peer-to-peer networking opportunity for some of the challenges that people face. So we'll be going over each of the councils in our structure. These are a current list of our Lens members, a wide variety of really premier institutions across the United States that are dedicated to advancing leadership development and really just taking care of their people. We're really fortunate to have this incredible group of people. And because we only learn more when we have more thoughts in the room and more people in the room to share their experiences, we're always looking to expand our Lens community. So this gives you an idea of who's involved in the follow-up materials. This list will also be in there as well. And this is an overview of the Lens structure. At the top, I guess, of our structure, we have our Lens steering committee. We typically have one person from each of our premier Lens member organizations sit on the steering committee to kind of direct what activities go on, which councils we're going to continue or sometimes sunset. We've recently just did this in the creation of a well-being council, which we'll talk about, because well-being was such an important topic in healthcare. It was kind of, we had this need to really create a council around how do we structure well-being in organizations. So and then, as you can see underneath the steering committee, we have each of these councils: our leadership development council, our diversity, equity, and inclusion council, our talent metrics, analytics, and planning council, and our well-being council. And I'll have the chairs each talk about these. You've heard enough from me. And so I'm going to actually transition it over to Tara if you want to talk about the steering committee and just in general what the benefits of Lens are.
Thanks, Melanie. Well, welcome and thanks for joining us this afternoon. So you can see from the slide that there's quite a bit of benefit from the Lens Steering Committee. However, what I don't think this slide really illustrates quite as well is really sort of the deep-seated value that you receive as being a Lens member and being a part of NCHL. So you can read on the slide, you know, the opportunities that we have for networking and discussing and problem solving. But I was going to share in sort of a little different way, really sort of the value that we see. So first and foremost, I would say that you gain an instant network. So, and you saw the diversity in healthcare organizations that join, you have an instant network of people to reach out to. And as part of that, we have something on the Lens Steering Committee where we sort of ask people, what keeps you up at night? And the value of that is knowing and understanding what your peers in healthcare are thinking and talking about, but also knowing where your organization fits in. Are you sort of worried about the same things, different things? And I think the value that it brings is you have the opportunity to talk about the good, the bad, the ugly. And sometimes when you're doing benchmarking and when you're talking with others and they promise to send their model or their structure, the difference with NCHL and what you get here is you're going to get the good, the bad, the ugly. They're going to share the details. They're going to share what they would do differently, how you could improve something, what they wouldn't do in the future. And I don't think you could put a price on the value of that. Healthcare moves very quickly. We get inundated with lots of new problems. And it's wonderful if I can pick up the phone to Patty and say, Patty, tell me about this. And why did you make this decision? What are your politics around this? I just don't think that there is a price that you can put on those things. As Lens members, we also talk about things like we will talk about vendor recommendations and vendors that we have worked with and vendors that we wouldn't work with in the future. We'll sort of talk about things related to what's respectively going on in our organizations, but we've also seen a lot of each other's organizations. So as part of this membership, you get the opportunity to go to other organizations, understand how their simulation center is set up, how they're doing leadership, what their structure is. So you get lots of fellowship. And again, it's back to that instant network and you develop the relationships. When we were first talking about this at Carillion, it's probably been, I don't know, 10 plus years ago, our COO came to me and he said, hey, Tara, we think this is going to be really valuable. And we think we're going to really gain a lot from sort of joining this and understanding what they do. And he was right. And we became a full member from the first day. And I can't tell you the value that it's brought to myself. Doug is one of my colleagues at Carillion Clinic, but we learn a lot and we grow a lot. And I think, although this slide sort of gives you sort of the bare minimum of what you get, I can't sort of express what you get in total value. So I recently had a situation where our CNO had seen, apparently the CNO at Northwell, I think it was Patty, and she was just enamored with a program that they had developed. And she's like, well, just call Northwell, Tara, and figure it out and we'll do that. And I can't tell you how easy it was just to pick up the phone or send Patty an email and say, hey, Patty, I heard you have this. Can you tell me more about it? Can you connect me? And she did. And I think that's just wonderful. And even through the pandemic, we helped each other a lot, either by listening to each other, serving as a sounding board. We talked strategy with each other. We also talked about the tactical things, like what are you doing and why are you focusing on that? So again, I just can't say enough about the value that Carillion has personally found. And I hope that all of you will consider joining in the future. So I'm going to turn it back over to DE&I. So
Jan.
Jan.
That would be me. Hello, everyone. So I would really have to reiterate what Tara just said in the perspective of the DE&I Council as well. The connections that we make with each other is phenomenal. We use each other's resources. More specifically, we focused on areas of standing up and implementing employee resource groups, the business case for diversity for your specific organization. We talk real time about what's going on in the world. Some of the examples that I can provide would be looking at what has happened in the world over the past year as it deals with racial injustice and social justice as a whole. And what are we doing for each organization in order to help our organization in that space? We utilize best practices throughout our continuum of leaders to help uplift our own organizations. I've been a part of this group for several years, and I heavily rely on my colleagues within the group on how we move forward with my own organization within Henry Ford Health System. Understanding that each organization may be at a different space at a different time, but that's what absolutely brings value because we can help each other within that space. This month or end of last month, we took some time and we talked about PTSD and how that both relates to COVID and also with those that have had traumatic experiences within our minority populations within our organizations. And we had a physician come in and talk to the group. I received astounding feedback from that conversation. And they actually left with contact information as to how they can uplift that work within their organization. So that's just an example of how we collaborate together with using each other to uplift us in that space. We meet monthly. And sometimes I get feedback and very often to say, hey, we need to meet bi-monthly, you know, so we'll have to look at that. But the conversations are very, very rich and very, very supportive of each other. As I said, the instant network is, you know, the greatest value that I see in there. I could call any organization at any time to help me in any area. I use Northwell, just like Tara, with our vaccine deployment strategy and also our vaccine hesitancy strategy for Henry Ford Health System, leaned on them in that space. And then in return, they've leaned on us quite a bit in other spaces as well. So if you're looking for value, the value is absolutely there. And I absolutely encourage you to join. I wouldn't, it would be difficult for me to do my work without it. And so if you want to know value, that's it. You know, the relationships and just the sheer amount of sharing that happens in that group is phenomenal. So any questions at all?
I have a question. Oh,
Yes.
it's Pamela Davidson here.
Hi,
And
Pamela.
I'm at UCLA, and I just, I was just wondering if you guys collect any metrics or evaluation data on what you're doing, because I know you do have one task force that's very metrics oriented. But for example, the diversity area, do you track anything on to monitor your activities? Do you have any sort of database related to your council?
We don't, and that's something that we're looking to implement this year. Historically, we have ran the council where it was a lot of learning in the space, right? And not too much of actual implementation. But we are transitioning now into implementation, and I do believe that that's going to be a part of it, whereas we track. Now, we do have a lot of conversation and sharing around what we're doing within organizations and the scorecards that you're keeping within your organization and using that information to implement within your own organization. That is there and very prevalent, but as far as what we're doing with NCHL, that's yet to be implemented.
You know, that's a brilliant idea. And just since you have a national focus, you know, one thing the council might consider would be taking an inventory of the kinds of instruments used across the country at the major health systems.
Absolutely.
DEI, that would be a great service. I haven't seen anything like that in the literature, but it would be something that might be a great project.
Absolutely. I totally agree. Any other questions? Okay, thank you. Over to you, Melanie.
Thanks, Jan. The one thing, Pamela, I will note is that the Diversity Council has been really good about at least doing a project every year. So last year, a mentorship guide was released for diversity and inclusion. And we are in the process of working on a health equity project as well to get an idea of what people are doing. So per Jan's point, we don't have like, we don't systematically collect data each year and do benchmarking like that, but each council kind of works on their individual projects, and they also vary by group, as you'll hear from the other council chairs as well. But thank you, Jan, so much for sharing. All right, Patty.
So good afternoon, everyone. I'm Patty Edelman, and I am the Vice President at the Center for Learning and Innovation, which is the corporate university for Northwell Health. It's a pleasure to see everybody's faces. I certainly can echo what Tara and Jan have said as far as being able to reap benefits from an organizational perspective. But before I go on about that, I'm just going to give you a little bit of background for the Leadership Development Council. As Melanie had said before, healthcare is changing very rapidly, and the Leadership Development Council is actually born out of sort of one of those changes. Prior to becoming the Leadership Development Council, there were two separate councils which were focusing on different sides of leadership. One was our Physician Leadership Development Council, focusing on specifically physician leaders, and one was our Coaching Council, which really focused on coaching, feedback, and leadership development. And so in order to help pave way for the Wellbeing Council, the Physician Leadership Development and Coaching Councils came together for a broader perspective on leadership development. This is not only allowing us to pave the way for the Wellbeing Council, but I think is really following industry trend, which is that physician leaders and administrative leaders, as well as other clinical leaders, are forming teams together. And the more we can address their leadership development together, the better off the teams hopefully will function in what I'm going to call the real world, right? In all of our organizations. So this council is new for 2021 in its new format. It is a great opportunity for all individuals who touch leadership development in some way, shape, or form to come together. So whether that's from the HR space, the learning and development space, the organizational development space, the change management space, leaders are definitely, as we saw in the end of 2019 and all of 2020 and so far in 21, really very important from the perspective of helping organizations survive change and uncertainty. And so like in Jan's council in thinking about diversity, equity, and inclusion, here in leadership development, we're talking about how do we give or help ensure that our leaders have the necessary skill sets, not only for today, but well into the future. How do we ensure that they can help their team members sustain the stress of being in healthcare in this time frame? And how do we give them support as being leaders themselves facing an uncertain environment? It's very difficult, obviously, in the healthcare environment to send your team into uncertainty, especially around COVID. So how do we not only protect our team members, but also, give strength to our leaders? It's been a great council. I was the chair initially for our Physician Leadership Development Council, and now for the Leadership Development Council, and being able to broaden our horizons and the perspective has been wonderful. We've brought in lots of new team members and looking at leadership development from a couple of different vantage points definitely has rounded out the discussion for sure. Thinking not only about the learning and development from a tactical perspective and what I'm going to call a hard skill or experience, but also thinking about it from a coaching and development perspective, and also thinking about it from a real world experience perspective. So I don't know that I agree with the 70, 20, 10 number rule, but I definitely agree with the theory from how you develop an individual by providing them a skill set, providing them with the experience, and making sure that they get the right feedback. And this council has been a really great way of helping share in between organizations, leadership development programs, the type of experiences that individuals are able to garner through those programs, who really gets the leadership development, how do we make sure that emerging leaders are well cared for as well. And a lot of discussion has come up over the past year, not only about the physician leader, but the nursing and the advanced care provider leader as well, and just making sure that they're leading teams in these times or times of stress adequately. There have been lots of projects, as Melanie said. The long-standing one was working on a very specific healthcare and physician and leadership development 360 as an example. Just really taking what's important and pertinent to the team members and bringing it to fruition. And the team actually, I think along with some of the other councils, just started an opportunity where we can get very quick feedback from other organizations. And so I guess by way of survey, so that we can collate the information. And it's, Pamela, it's not a true benchmark where we get necessarily measurements, but we can really see side by side what different organizations are doing from a leadership development perspective, and understand kind of who they're hitting, how they're doing it, the time frame from which, and certainly in today's world, how they're choosing to deliver it. Certainly happy to take any questions with regard to leadership development, but it's been great, and I certainly wouldn't have kept my post for the last 6 years if I didn't think it was worth the return on investment.
Thanks, Patty.
I'm not sure if anybody had a question, but certainly happy to answer.
Well, Patty, I was intrigued by what you said about the side by side comparison. It sounded like it was of the 360 and how the plans come out of that, or maybe I was trying to envision it, but it wasn't completely clear.
So I apologize if I wasn't clear. Those were sort of two separate thoughts, but the 360 will give us, or the design originally was to hopefully give us some benchmarking with our peers, and the peers being those in the Lens councils, so that we can compare organization to organization. However, what I was talking about is if I really wanted a question to be put out there to the whole group, like we're starting an emerging leader program, and I'm curious as to what it is that everybody here is doing. Instead of getting back maybe 15 different emails with different pieces of information, we have stood up what I would call a survey. I guess that's the best way to put it, where that question goes out to all of the members, and Melanie is absolutely wonderful in being able to help us collate that information. And so let's just say there were 5 questions that I really wanted to ask. The answers for all 10 or 15 members get collated so that I can look at not only, Pamela, does UCLA already have this, but what are they doing? How are they actually putting this together? Or figuring out that, Northwell doesn't have something, or, that Henry Ford or Carillion is doing it in this way. And this way it gives me the ability to benchmark what it is that we're thinking of doing, or what we've just implemented to other, top-notch organizations around the country.
Sounds fabulous. Thank you.
You're welcome.
Yeah, and that was when Patty says recent, this was just started like about a month or 2 months ago. And so we're working on trying to roll this out to other councils as well, this type of format. But the other thing we recently rolled out is we do have a member portal, and those have new discussion boards as well for people to receive instant, well, hopefully instant feedback, depending on how quickly people reply, but feedback portal for people to receive answers to their questions. So lots of ways to communicate with one another. All right. Thank you, Patty. Doug, you're up next.
Thanks, Melanie. As Melanie mentioned in the introduction, my name is Doug Crowder. I'm the Director of Workforce Intelligence at Carillion Clinic, and I serve as the Chair of the Talent Metrics Analytics and Planning Council. It's a little bit of a mouthful, so we affectionately refer to it as TMAP for short. I've been in this role as council chair. I think this is going into the 3rd year. I've been a member of the council for, I believe, 5 years since its inception. And I would just echo what everyone else has said. The value that I have found from being able to access a network of my peers in this space has been just invaluable. And I'll talk a little bit about our work and some of the things that we've done recently. First, TMAP meets monthly on the 3rd Wednesday of every month. Pre-COVID, we did meet in person typically twice a year, kind of a once a year mid-year check-in, and then again when we were together as part of NCHL's annual Human Capital Investment Conference. Obviously, the healthcare landscape is changing. The workforce is changing, and organizations need talent data and HR analytics and workforce planning information to help inform the organization's people strategies. So we really try to approach this as a council with a goal of really sharing our approaches to this work in an effort to strengthen each of our own organization's abilities and capabilities to better understand our workforces, inform decision making, and ultimately, improve business performance through our people. One of the things that I think is really great about this council is we have folks and organizations that are really kind of across the board on where they are in the kind of talent metrics and analytics space, from organizations that are just getting approval from their leadership to stand up a function that does this type of work, to some organizations like Northwell and like Carillion that's been doing this work for a few years now. So it's really great to have perspectives from kind of across the continuum. This space in itself is really kind of in its infancy within HR using data and analytics. It's only something that's been really talked about with a lot of sophistication and rigor over the last 15 years or so. So it's really nice to know that there are others that are on this journey with us, and we can lean into them and access others as a resource for brainstorming, just ideas, facing challenges, and the like. So we really kind of, like others have said, we focus on 2 things as a council. One is kind of what we would call shared learning, and the other is interorganizational collaboration. From a shared learning perspective, we accomplish just a couple of ways. One thing we do, we call Journal Club, and we really monitor the research and the literature that's out in this space and discuss the relevance of its content to our own organizations. We also bring in guest speakers from both inside and outside of healthcare. A few examples, some people analytics and IO psychology experts, strategic management decisions, which is Crest Gainey's solution, people analytics folks from Eli Lilly and Company, Common Spirit Health within healthcare, and the Illinois Institute of Technology, just as a few examples. We approach the interorganizational collaboration by really each member or organization sharing the internal work that they're doing within their organizations. And again, that's really, it's across the continuum because folks are really in a lot of different places where they're at on this journey. So it may be things like we've had one hospital share how they use their employee survey data to help predict turnover. Another organization has shared how they use business intelligence tools to help identify kind of key shifts and key HR metrics. Something that we're currently doing, and I think Patty kind of mentioned this a little bit with being able to survey your peers. We are doing an RN turnover survey, right now as we speak. We wanted to, as a council, see where RN turnover was, or how it was impacted by the pandemic and how it continues to be impacted by the pandemic. It's not really kind of getting down into the nitty gritty of everyone reporting their numbers because folks can, report things a little bit differently, include certain things, exclude certain things. We really wanted to see just for each hospital, is your RN turnover worse or better or the same as it was before 12 months ago, recent 6 months? How do you see it over the next 12 months as well, so that we're all probably at least in function similar to mine, reporting RN turnover and looking at trends, and inevitably the question's been, what's the impact of the pandemic and what are others experiencing nationally? So being able to have access to such a large group of varied healthcare organizations across the country has been really awesome to tap into. So again, kind of in short, having others with us that we know are on the same journey of standing up HR metrics and analytics and workforce planning shops in each of our own organizations and being at various places along that journey and having folks to tap into has been an invaluable resource. It's been something that I have learned a lot from over the last 5 years that I've been involved with it, and looking forward to what we continue to do in the future.
Thanks, Doug. In light of the trend of asking questions after each one, does anyone have any immediate questions? We can also take questions at the end as we're building upon each council here.
Okay, I'll ask a question or make a comment since that's been the trend. I really like what you're saying, Doug. And what occurred to me was I wonder if a journal article could come out of the work that you're doing, because I think it would be great for NCHL, and it's also great, to have your own articles when you're a senior executive and you have certain insights. I think after what I've heard from all the councils, I would suggest that the councils consider, or maybe you've already done that, but if you haven't done it, I would suggest that you consider doing it, and the staff would be able to support you on it. But it would be great to get that kind of visibility nationally. And if you've already done it, you can tell me now, but that's what came to my mind when you were speaking.
I saw Melanie's smile light up when you said that, and that is certainly something that she has encouraged us to think about. What can we produce, either a product or an article, research, sharing at some national conferences that are kind of focused on this space, like the Society for Industrial and Organizational Psychology. So that is certainly something on our radar.
Yeah, I would love to do research all day long, but so for the health equity study in particular for DE&I, I'm working with a member to try and publish some of that. So it's an internal strategy for NCHL in general to try and disseminate more research coming out of our work. So definitely something we're trying to expand, and certainly something that I'm excited about. So you're on the right track there, Pamela. All right, Catherine, last but not least.
Still here and well with the storm outside, so I'm thankful for that. Hi, my name is Catherine Meese. I'm an assistant professor and director at UAB, and I teach in organizational behavior and leadership in the Department of Health Services Administration and serve as the UAB Director of Wellness Research for the UAB Medicine Office of Wellness. I'm thrilled to have the opportunity to chair this council, this inaugural council. I don't think you could have made it through one day of the past year without thinking about well-being or lack thereof, especially in the healthcare environment. Reading the news, seeing firsthand in our own organizations the hardships that our employees were going through. And so it's really been an honor to be able to launch this council at a time where more people are paying attention to well-being. It's always been important. Physician, nurse, and other clinician burnout has been a problem for a long time, but fortunately COVID has plunged that issue into the forefront of people's consciousness. And so there's more of a recognition that this is a critical issue. So really our goals of this council, as many others have mentioned, is the peer-to-peer sharing, which has really already proved to be wonderful. So we've only had 2 council meetings so far. We're brand new. We meet every other month, but already there's been almost just a collective sigh of relief when we get to hear from other folks that are struggling just as much as we are to care for the well-being of our employees within our organizations, and this sense of, okay, it's not just us. So I think collectively as a country, our healthcare workers are in a difficult place, and they have been for over a year. And so in addition to understanding what's worked well in this sort of crisis scenario where we've had to adapt very quickly and create an environment of holding, there's also a shared interest in understanding what does wellness beyond this pandemic look like, and how do we keep the attention on this very important issue that is really central to our ability to provide safe and excellent patient care. So if we're not optimizing and caring for the caregivers, they're not going to be able to do their best work. And so with that, we're in the get to know you phase. So each meeting, we have our various participating members present about their organization, how well-being efforts are structured within the organization, which the answer is it's different everywhere. There's a lot of evolution in this space. And also to share what different resources they're using, what different programs they have, how they've been able to encourage better uptake of those programs, et cetera. And really just in our first couple meetings, I've seen tremendous fruit from this council. In the first one, I was putting together a national council and said I need some people from around the country to share their expertise, and immediately 3 hands went up. So saw great collaboration from that and was able to really get our message out to a national forum, which was great in a webinar format. And then the very next meeting, one of our members was looking at deploying using a new vendor for a wellness program, and several other members had used that vendor and had checked out others. And so we were able to have some very quick learning about, what's good and what's bad, and information that you're never going to get from the vendor themselves. So really can see the benefit of this already in such a short time. In terms of our next steps as a council, after we get to know each other a little bit better, we'll work collectively to define goals and objectives for what we think Generation 2.0 of well-being needs to look like in a post-COVID world. And additionally, we're exploring options for multi-institutional research. So there are varying degrees of interest in that from our council members. I think given the tremendous legwork that it takes to do that type of research, but we also have people who are members of the council who specialize in research, and who that's their passion, and that's what fills them up. And so I think we'll be able to find some great opportunities there to really make an impact on the industry with information coming from a variety of leading health systems across the country. So I'll leave it there in case there are any questions, but just cannot say enough how much already this being part of this council has benefited me in my role and being able to bring actionable insights back to our organization based on the experience of others who are more established in the field and less established in the field. So we're all learning together.
Okay, I'll ask a question. In looking across all the councils, it occurs to me, which ones would have a better probability of getting foundation or extramural funding through NCHL. And the two are really that come to mind are the diversity, of course, because there's a lot of money out there for diversity and equity and inclusion right now, a ton of money. So that's one area and one council that could probably be able to bring in money for R&D. And the other one obviously is well-being. And so I guess I would encourage you, Catherine, and NCHL to really look for funding sources so that you would have the research support to do really wonderful inter-organizational research. But I think those two areas are more fundable. And then the rest would be, well, gee, why aren't the organizations picking it up? But those two areas, I think, would be most likely and have the highest probability for funding. It sounds very exciting.
I'm glad you mentioned that, Pamela, and that's a great thought. You know, when you said that, it sparked something that I had meant to speak to, that, you know, even if you belong to one Lens council, you're still benefiting from a lot of collaboration among the councils. So just in my very short time here, you know, I had a call with Doug where I was about to do some measurement for our organization and said, okay, what metrics are you using, and what correlates were most important in your organization? And you know, speaking to your comment about fundability, you know, diversity, equity, inclusion, and well-being are very closely related. We know that persons of color and women and members of the LGBTQ community experience stress in different ways within our organizations. And we also know that people who are experiencing burnout have a higher incidence of showing racial bias towards patients and colleagues. So, you know, I think there's a lot of continued opportunity for overlap among these different areas as the councils continue to grow and mature.
Amazing. Thank you, Catherine. All right. So thank you so much to our chairs for discussing the benefits that you've all had by participating in your councils. I mean, truly, the work is just exciting. The councils are really passionate about everything that they do and everything that they pursue. And it's fun on my end to see how everyone grows and develops their own programs. So it's exciting to hear about it all in one setting for myself as well. But so if we've sparked your interest, I suppose the next step is how to join Lens. We do have different varying structures. So depending on which level of membership you're interested in, refers to basically the amount of councils that you get access to. So at a premium Lens membership, you have access to the steering committee and all of our Lens councils. At a basic membership level, which is new for this year, you have access to 3 councils. And an individual council membership is access to 1 council. We do have some organizations that do that. They say, you know, I really need help with diversity, equity, and inclusion. I'm going to join this council at this time because it makes the most sense for my organization. So lots of different ways to get involved. The other thing I'll mention that I don't have on these slides, but it's just important to note, is there is other benefits to becoming a Lens member. It's not just the councils per se. We do things like I release monthly executive briefings, which are research summaries that go out to everyone of the most recent literature. It varies across the different topics. I try to hit each of the councils in terms of topics, but those go out each month. We also have our annual Human Capital Investment Conference that goes on, which Lens members currently get tickets to. So being able to collaborate in person over that and have like a centralized time for learning. And then we also have various programs that we run. So we do have a coaching certification program as an example that we run that Lens members get discounts to. At the premium level, you get the best discount. At the council level, you get the good discount. But so we do offer other programs like that as well. So lots of things to partake in and get involved with. And I think we're continuing to grow and do incredible things. So I will send out an overview of Lens membership benefits following this call to everyone who is on here today. But I guess, what questions do you have for any of our members, for me, anything that we can ask? We're so happy you were able to attend with us today.
Melanie, I would just add one thing as we're waiting for questions. And thank you to all of the council chairs. It's your testimonials and your comments are valued. And thank you so much for sharing today. And thanks to everybody for being here. The membership is a calendar cycle. I would just add that it runs from January through December. But that doesn't mean you can't join throughout the year. We would just prorate your membership whenever you join, but it's an annual membership.
Thanks, Leanne. All right. I don't hear any questions. I guess from our members while you're here, is there anything else anyone would like to share? Any parting thoughts, pieces of wisdom, anything like that?
Melanie, nothing more to add except that if there's anybody who's interested today and you want to talk to one or all of us, I mean, we're happy to reach out and sort of share more details if you're interested. So thank you for attending.
Thanks for that, Tara.
And I just wanted to say, I'm just so impressed with what you're doing, and I really appreciate being able to attend today. And it's just very exciting what you're all doing. It's wonderful work. And so thank you for letting me hear all about it. Just keep going. And it's going to be an even better year this year.
I can agree with that. Thanks.
Hey, Melanie, this is Casey Nickel. Because we have some time, I'll go ahead and ask the same question that I emailed you just last week, but I'd be curious to hear from the Leader Development Council what leader effectiveness looks like for this council specifically and how it's currently being measured.
So that is definitely a good question. And I think there's not necessarily one specific answer that I would give. It's a little bit like Jan and what she was saying before, Diversity, Equity, and Inclusion Council is different organizations are in different spaces, even believe it or not, on the leadership development track. Some do it internally, some only do it externally. Some have small programs, some have very large programs. So the ability to define one specific idea of leadership development and a measurement is just something that I'm going to say, hasn't necessarily come up. There have been questions, Casey, about how we each measure leadership, good, quote unquote, good leadership, or the impact of the leadership development programs on our different organizations, but haven't necessarily set per se a gold standard for what to do, just because each organization is a little bit different. Hopefully that answers some of your question. I do think that as this Leadership Council continues to grow, and as I mentioned before, the Leadership Development Council is a mixture of two previous councils, the Coaching Council and the Physician Leadership Council, that we might get there. It's just that, as I said, each organization is in a slightly different space, and the people who came into this council came sort of with different hats on. So we're still in a little bit of the forming and storming and norming portion of group membership, but definitely something to think about as we move forward.
Yeah, that's helpful. I appreciate that. At Norton Healthcare, our Leader and Development team, Institute for Education and Development, is outside of our Human Resources team. So we just recently rolled out the competency model just over a year ago, and we've had great success with it in terms of participant enrollment and completion of the course that we've created, and great feedback on surveys, post course. But our HR department is really asking for some metrics around how do you know you've been successful, and how do you know that these leaders are getting what they need, and how are you measuring leader effectiveness? And we feel like we're a little bit on hot seat to answer those questions, and to we can measure retention and we can measure engagement, but how do you measure more of those soft skills, and what does that look like is our challenge right now.
Yeah, not to just only plug for leadership development, but I think that those are conversations that we continually have. in probably all of the lens councils, which is how is everybody measuring and how are we showing our effectiveness to our organizations. The difference, I guess, sometimes is, you know, for some, it's the learning and development function is inside HR. At Northwell, we, like you, are outside of the HR function. And so the way in which or who it is that might measure might be a little different, but the same goals nonetheless. And I think that's one of the benefits I had talked about before and Pamela had asked about was in those quick surveys, it's really good to be able to ask a question like that. You know, how are you measuring X, Y, and Z and being able to get the group's feedback? It may not fit for you exactly off the shelf, you know, whatever comes back, but it's good to know that this is what some other organizations around the country are doing. And here's what we can do now. And here's what we can work towards in the future.
Great. Thank you.
You
I
know,
appreciate that.
Casey, and I can't help myself because I'm also I'm a professional evaluator. So I would say too, essentially look at the goals of your program or intervention. Like, what is it that you're trying to do with that leadership development program exactly? And then the measurement follows straight from your goals because your goals should be reflected in your outcomes of the program. So really always, you know, looking at the direct link between what are the goals of my program and what are the outcomes, and that is what you measure. And so I would say, you know, also just look into maybe you have an evaluator at your organization or some core, like I'm part of the CTSI evaluation core at UCLA. You know, and there's evaluation expertise around, so maybe also a consultation from someone in evaluation would be good. Specifically.
Thank you so much. I appreciate that.
Yeah, I hope.
Yeah, thank you.
Casey, I'll just add that I do have a couple of people to connect you with for your question. So I'll be connecting you with them. But as you said that as well, I do have an article I can send to you related to leadership development outcomes, which came from the executive briefing. So this all comes full circle.
Awesome. I would love that. Thank you.
Sure, no problem. Thanks for the question. We have about 5 minutes left before we hop off here. Does anyone else have any questions that we can answer for the folks still on the call? All right. I've gotten better with the silence thing. I teach a group of students now, and I need to remember to be silent for a little bit to see if there's any more questions. So still working on that, but thank you everyone for joining us today. If you have any questions, feel free to reach out to me. I can connect you with anyone on this call today or any of the members you might be interested in speaking to about Lens membership, and I'll be sending out the materials for Lens membership benefits. So thank you everyone and have a wonderful day.
Thank you.
Thanks, everyone.
Bye. Bye.